Hi friends, welcome to Pharmacology. So in today's video, we are going to see how we can interpret a CBC report. As you know, CBC stands for complete blood count. So a complete blood count evaluates your red blood cells, white blood cells and platelets. So you all know that the main function of red blood cells is to carry oxygen and white blood cells helps to fight infection, whereas the platelets helps in clotting. So here you can see a sample CBC report and what all are the tests that comes under the CBC. Mainly the red blood cells. Under red blood cells you can see hemoglobin, hematocrit, RBC count, MCV, MCH, MCHC and RDW. Then under white blood cells, mainly this WBC count as well as a differential count and platelets. So these all are the main tests that comes under CBC report. So first we will start with the red blood cell parameters or RBC parameters. So under this, the first test is hemoglobin or HB. So it mainly shows the amount of oxygen carrying protein. So here you can see the normal range. In males, it is 13 to 17 gram per deciliter, whereas in females, 12 to 15 gram per deciliter. So low value of hemoglobin indicates anemia, blood loss, chronic disease, whereas high values indicative of dehydration, polycythemia. Next comes the hematocrit, which is denoted as HCT. So it shows the percentage of blood made of RBCs. Normal value in males is 40 to 52 percentage, whereas in females is 36 to 46 percentage. Low value shows anemia, blood loss. High value is indicative of dehydration. Next test is RBC count. It shows the number of red blood cells. In males, the normal value is 4.5 to 5.9, whereas in females, 4 to 5.2 million per microliter. Low value is indicative of anemia, whereas high value indicates polycythemia. Next comes the RBC indices. So these tests mainly helps to classify the type of anemia. So under this, the first parameter is MCV, also known as mean cell volume. It shows the average size of red blood cells. Normal value is between 80 to 100 femtoliter. Low value shows microcytic, that is iron deficiency anemia, whereas high value of MCV indicates macrocytic anemia. It can be B12 or folate deficiency anemia. Next is MCH, that is mean cell hemoglobin. It shows the amount of hemoglobin per RBC. Normal value is between 27 to 33 picogram. Low value shows hypochromia. Next is MCHC, that is mean cell hemoglobin concentration. It indicates the concentration of hemoglobin in red blood cells. Normal value is in between 32 to 36 gram per deciliter. Low value is indicative of hypochromia. Next is RDW, also known as red cell distribution width. So it shows the variation in size of RBCs. Normal values in the range of 11.5 to 14.5 percentage. High values indicative of mixed sizes, that is early iron deficiency anemia. So that's all about the red blood cell or RBC parameters. Next comes the WBCs or white blood cells. So under this, the first test is total WBC count. Normal range is in between 4,000 to 11,000 per microliter. So a high value of WBC means leukocytosis may be indicative of infection, inflammation, leukemia, stress, steroids. Next is low value of WBC, which is known as leukopenia. It shows viral infection, bone marrow suppression or certain medications. Next comes the differential count. So this differential count helps us to identify the type of infection or condition. So the differential count mainly consists of this neutrophil count, then lymphocytes, monocytes, eosinophils and basophils. The neutrophils, the normal range is in between 40 to 70%. It is increased in conditions such as bacterial infection, inflammation, stress. Then lymphocytes, normal range is in between 20 to 40%. It is increased in conditions such as viral infection, pertussis, then tuberculosis, chronic lymphocytic leukemia. Monocytes, normal range is 2 to 8%. It is increased in cases of chronic infection, autoimmune disease. Then eosinophils, normal values between 1 to 4%. It is increased in allergy, asthma, then parasites, drug reactions. Next comes the basophils, normal values between 0 to 1%. It is increased in allergy, hypothyroidism, then myeloproliferative disorders, etc. So that's about the WBC count as well as the differential count. Next parameter is platelets. So this platelets helps in clotting. So the platelet count, the normal range is in between 1.5 to 4 lakhs per microliter. Then low value of platelet count, which is known as thrombocytopenia, it may be indicative of bleeding risk, then idiopathic thrombocytopenic purpura, bone marrow problem, or certain drugs or infections. Then high count of platelets, known as thrombocytosis, it may be due to clotting risk, inflammation, iron deficiency after surgery or splenectomy. So we have discussed the three main parameters that are mainly monitored in a CBC report. That is the red blood cell parameters, then white blood cell count as well as the differential count, then platelets. So now we'll see a quick interpretation guide. So here you can see the common patterns and the possible cause. If there is a decrease in hemoglobin, decrease in hematocrit and decrease in MCV, the possible cause may be iron deficiency anemia. And if there is a decrease in hemoglobin and increase in MCV, the possible cause may be B12 or folate deficiency anemia. Then decrease in hemoglobin and normal MCV, it may be of anemia of chronic disease or blood loss. Then increase in WBC, that is white blood cell count, mainly the neutrophils, the possible cause will be bacterial infection. Whereas if there is an increase in WBC, mainly the lymphocytes, the possible cause may be viral infection. Then decrease in platelets may be due to bleeding risk, mainly the ITP, that is idiopathic thrombocytopenic purpura, marrow suppression or infection. Then increase in platelets may be due to clotting risk, inflammation or iron deficiency. So now we'll see the or examine the sample CBC report. So first we'll see the red blood cells. So under hemoglobin, here you can see the value is 11.2. If we examine the normal range, we can see that this HB value is low. And also this hematocrit, it is 33.5. It is also low. Then RBC count, it is 3.8. It is also less than the normal value. Then MCV, it is 76, it is also low. Then MCH, it is 25, which is also below the normal range. Then MCHC, it is 31. So all these values, that is hemoglobin, hematocrit, RBC count, MCV, MCH, MCHC, all these are low except this RDW. Its value is 16. Normal value is between 11.5 to 14.5. So except this RDW, all these other red blood cell parameters are low. Then, so which shows it can be or the possible cause may be an iron deficiency anemia. Next comes the white blood cells. So WBC count, it is 12,500. Here you can see the normal value, which is 4,000 to 11,000. So this 12,500 is high. Okay, so the WBC count is high, which may be due to any kind of infection. Next, let's examine the differential count. Neutrophils value is 72, which is high. Okay, that is 40 to 70 is the normal value. Then lymphocytes value is 18. So which is below the normal range. Normal range is 20 to 40. So here neutrophils are high whereas these lymphocytes are low. So if we see here, if there is an increase in neutrophils, it may be a bacterial infection. And if there is an increase in lymphocytes, it is indicative of a viral infection. So in this sample report, the patient might be experiencing a bacterial infection because here the WBC count is also high and the neutrophil count is also high. So under this differential count, neutrophils are high. Okay, 72. So the patient might be experiencing a bacterial infection. So the remaining other these monocytes, eosinophils and basophils are all under the normal range. Then platelets also normal, that is 1.5 lakhs per microliter, that also comes under the normal range. So I hope you all have understood how to interpret a CBC report. So this will be useful for all candidates, especially those who are preparing for any kind of exam, as well as it can be useful for patients as well. So thank you everyone for watching this video. Please don't forget to like, share and subscribe. Have a great day.